Hey, Get Healthy UTV squad. Welcome in to our monthly Q&A available for all Get Healthy UTV members and non-members, whoever you are, welcome. I'm Chris Freytag, and I am here today with, of course, my sidekick, the well-known Sam Cam.
I'm back.
How are you?
Good, how are you?
Awesome, and we have a really interesting and awesome guest today, Kelly Sturm. Kelly is a board-certified oncology clinical specialist. I'm reading this so I don't mess up the words. Certified lymphedema therapist, doctor of physical therapy, and knower of all things lymphatic drainage.
Absolutely.
Hi, Kelly.
Hi, thanks for having me.
So glad you're here. Kelly is a friend of mine and also an expert in the lymphatic drainage and lymphedema space. We were just talking before we came on about some of the misconceptions out there. You guys know in the wellness space, I'm so passionate about wellness and the wellness space, but things go viral for interesting reasons. People glom onto them and they say, oh, I'm supposed to be doing this, I'm supposed to be taking that, and lymphatic drainage is having a moment right now. We hear from people like, what are you doing for lymphatic drainage? How do you do it? What should we be doing? So let's uncover all of that today. We want to take your questions, so feel free to answer or to write in, and Sam Cam is the keeper of all questions. We'll go through questions. We have subjects that Kelly wants to cover, so this is going to be a busy hour. But already, before we came on with you guys, in the last 10 minutes, I have really learned a lot about lymphatic drainage, and I'm really excited to talk about it. So I know that you do have a bunch of questions, but let's just start with what the lymphatic system actually is. You hear things on the internet and you're like, what is that? Where is that in my body? Like, what am I doing about it?
Yeah, the lymphatic drainage is one that I don't think a lot of people know about. Really, it is a system just like your circulatory system. So your heart pumps blood through your veins, and then through your arteries, and then your veins bring it back to your heart. Your lymphatics runs right with your veins, and it brings some of the fluid that comes out of the blood, which has proteins in it, back to your heart. But before it gets back to your heart, it is filtered in your lymph nodes and gets out any like bacteria or toxins or anything that shouldn't be there, cleans it all out, and then it comes back to your heart. So it's just a system that helps with your immune system. It helps with circulatory system. There's a lot that it does, but it's not talked about a lot until now.
Until now. So now it's having a moment because now people are like, well, should I be doing something about it? So let me ask you this then, and then we'll get into some of these questions. It's just a system in your body that works just like your digestive system works or your heart works. We don't need to be so worried about our lymphatic system unless there's a problem with it, right?
Exactly. So the majority of people have a healthy lymphatic system that is working as it needs to, doing what you naturally do each day. And then there are some people who have what we call lymphatic dysfunction, who have a medical condition where the lymphatics is not working properly or they were not born with the proper lymphatics. And then there's things that we do to treat that.
Okay, so let's everybody take a deep breath. You do not have to worry about your lymphatic system, but let's find out more about how it works. And Kelly, you tend to also work with people who are medically diagnosed with lymphedema or cancer patients that have had lymph nodes removed. And that also, if you are anybody who is a cancer survivor who has had lymph nodes removed, please ask your questions. You have the specialist here right now. Sam, where do we want to start?
So Chris asked the first question. The second question is, what is lymphedema? What is lymphedema, and how is that different or not from what people call lymphatic drainage? Is it different?
Yeah, so that is different. So lymphedema is a medical diagnosis. That is something that someone has. So either someone is born with it, which is about 20% of the time, and it may show up as a child. It may not show up until they're a little bit older in age. And then someone who has what we call secondary lymphedema is something that comes on because of typically a trauma, or for a lot of people it is lymph nodes are taken due to cancer or irradiated, or even I haven't seen people who've had car accidents and have had major trauma, like they have orthopedically maybe fractured a bone or whatnot, and then also damage their lymphatics, and so their lymphatics aren't working. They now have lymphedema as well. So it is different. Lymphatic drainage is a treatment we do for lymphedema.
Okay, and lymphatic drainage is something that you already mentioned, like the lymphatic system works. It should be working in your body just like other systems are working in your body. You don't every day worry about every system in your body, or you're going to have a worry disorder. Right?
Right.
And so I think we're going to get into should everybody be doing something for their lymphatic system every day? Or is that kind of this viral myth that it's one of those wellness things you're supposed to be doing?
Yeah, so break it down, lymphatic drainage is a treatment. It's a way for us to help move the fluid that's congested somewhere. So when someone has lymphedema, they have swelling. It's usually very visible in their legs or their arms, breast or chest, wherever they might have it. And we are helping to massage or guide that fluid through the vessels and towards those lymph nodes to help, decongest it, to help get the fluid out of that area that is swollen. It's stuck there. So that is a treatment that we do. But your lymphatics normally, it does that normally. So your lymphatics doesn't have a natural pump. You have lymphatic vessels, hundreds of thousands throughout your body, just like your veins and your arteries. They're even smaller. And with your circulatory system, your heart is what pumps the blood through your arteries and your veins. The lymphatics doesn't have a natural pump. So what actually pumps fluid is your muscles by you moving, by you getting up and exercising and moving your body in any shape or form. You are moving your lymphatics. You are helping your lymphatic system.
I just love this. This is a new tool in our arsenal, Sam, to tell people. We're always telling people strength training builds bone mass, builds muscle, helps with insulin sensitivity, helps with blah, blah, blah. But now a new tool in our arsenal is it helps with your lymphatic system.
Yeah.
It acts as a pump for that. I love this.
Exactly.
That is, so people, there's a reason why we keep telling you to move. I've been joking about this week. I've been saying, it turns out the fountain of youth is not a fountain, it's a dumbbell.
It's
a dumbbell.
I like it.
Pick it up, people. Start strength training. Okay.
You touched on it a little bit, but there is someone that is interested about this because her 7-month-old granddaughter was born with hydrops, which they said is a lymphatic disorder. So she's kind of hoping, is there some insight that they can do for someone that's 7 months old?
Yeah, absolutely. There are therapists. So I'm a lymphedema therapist. We treat those who have medical conditions like this. So there are lymphedema therapists all over who treat this. So they can be seen and find ways to help this individual, this pediatric patient. There are a couple foundations now out there that also help support families who have children with lymphedema. And so one is called Brylan's Feet, Brylan, Brylan's Feet, and they can find them on Instagram and on their website, and they have a wonderful resources to help connect you with someone who specializes in pediatric lymphedema.
I love that. And honestly, and actually we should be mentioning, I forgot to mention that she runs most of her practice now on YouTube. She has loads of videos for you to watch if you are somebody like this who has a pediatric patient or who themselves has gone through any lymph node removal, or if you are just somebody who wants to learn more about the lymphatic system. Kelly is a wealth of resources. We will put your YouTube channel up on the Q&A by the end of this or at the end of this so that everybody can check you out.
There's a lot of people saying they follow you already.
Oh,
so
that's great.
Awesome.
That's exciting.
Just for more information too, if someone's born with it, is it something that they always have, or is it something that can go away after time?
Unfortunately, lymphedema is lifelong.
Okay.
There isn't a cure right now. There are surgeries that are being done and we're learning more about, but there's still a little bit in the testing phase right now. I have seen some of my patients have surgeries and have really good results, but it's something they do need to monitor lifelong.
So if you are born, okay, I heard you say a stat that only 20% of people are actually genetically
correct
have this lymphedema. Okay, so if you are in that, then you should be, because is there a supplement you should take, or should you be doing the lymphatic drainage process every day, or how does that work for someone who has lymphedema? Let's talk about that.
Yeah.
And then let's talk about somebody who has no lymphatic issues. Should they be doing it?
That's great. So if someone has lymphedema, you really should be seeing a lymphatic specialist or lymphatic therapist, because that's going to look different for each person. When it comes to someone who has lymphedema, has a medical diagnosis, sometimes lymphatic drainage is just not enough. It's actually not a strong enough treatment to help alone. Things like compression, so think about compression stockings. We have different variety that we do or use for people who have lymphedema that are stronger. That's a big one. There are pneumatic compression pumps that people can wear for an hour a day instead of doing drainage. Exercise, we always push. Hydration, we always push. There are things like that. So it's not one treatment for lymphedema. It's a lot of treatments that we compile into a home program for someone.
I love it. Okay, and then if somebody is like Sam and I, we don't have lymphedema, we don't have lymphatic drainage issues, but I'm seeing online that I should be tapping my body in different places every day, and I'm worried about it now.
Yeah. Lymphatic drainage is not something that you have to do every day. Again, it's wonderful if you have lymphedema, or you might have congestion on occasion. Maybe you're swollen for sitting a long car ride, or for me, it's when I notice a cold coming on. It just, things are getting backed up is what that is sign of is. So it's something that you can do as a tool when needed. But I can tell you right now, if you don't feel like it serves you, lymphatic drainage takes more time for you each day, you don't have to do it. You can just focus on your exercise and staying hydrated and everything you would do normally to stay healthy.
Okay. In other words, it's not changing. It's not life changing to tap your body and rub your body.
Correct.
If you don't have an issue. I mean, hopefully, and if you are somebody who's exercising a lot, which we tend, a lot of our members, oh my gosh, they exercise all the time. They inspire Sam and I.
I say sometimes more than we do. We're like, should we get our butts off of our chairs?
What did you do yesterday? Oh my gosh. So, many of you are really putting in the effort. And so you can take that lymphatic drainage worry off your list.
Right.
We all have plenty of worries. Okay, Sam, any other?
Yeah, there's some questions rolling in. So you talked about compression socks. Can you wear compression garments for too long?
That's a good question. I would say no if you're wearing the right kind. So that's the biggest thing I see is compression stockings are meant to support, and you shouldn't be wearing them at night if you're getting the ones that are off of Amazon or online. We do make, I don't personally, but we can order custom garments for someone who has a lymphatic dysfunction. Those are usually safe to wear because they're made in a special way. Mm-hmm. So I would say if you're wearing general compression stockings you got online, I would not wear them all the time, just during the day or when you're moving. And if you have a lymphatic dysfunction, again, work with a therapist and then we can help you find something a little bit stronger.
Can you speak about lymphatics post-op, particularly like after a cosmetic surgery or something like that?
Yes, that is an area that is booming right now, and I know it's a big conversation. It is another way to help speed up the process for healing. So someone had a surgery, they're more swollen than they normally would be, which makes sense. Mm-hmm. What it could be is just more fluid. It makes sense, more inflammation going on, and so you can use lymphatic drainage as a tool to just help speed up that process.
So, all right, let's talk about, there are techniques on the internet. I get served videos of people doing tapping techniques, rubbing techniques, and sometimes in a good way, but sometimes with scare tactics, like you should be doing this for 10 minutes a morning or whatever. And I'm like, oh, for the love of, you know what, I can't add one more thing to my arsenal.
Right.
So talk about that. Like, let's just say you did just have a surgery, or you do feel a cold coming on, and you're like, I feel like I'm a little swollen in my lymph nodes. Where are the lymph nodes in your body, and what are these techniques?
Yeah, I think some people, especially if you're online, you'll hear Big Six, and that actually is a good reference to use.
Big Six.
The Big Six. Yep, that is okay. It's where your major lymph nodes are. You have hundreds and hundreds of lymph nodes all throughout your body, but there are major clusters. So there are some right around below your ear, right around where your collarbone on both sides, and then right in your armpits, and then right in the groin, which is right about where your sitting crease is when you sit. There are large ones there. And so the ones in your groin, your right leg, everything in your right leg goes to the right groin. Everything in your left leg goes to the left groin. Same thing. Upper bodies go to the armpit ones, and then your head and neck drain to below your ears, and then everything comes around to these major vessels that are near your collarbone. And so you can just stimulate those. I don't do a full lymphatic drainage routine most of the time. Even if I feel sick, I'll just massage those lymph nodes because you can feel them. They're swollen. Your doctor checks they're swollen. So we can just do massaging. And so one thing I see online is people talking about the tapping, or you'll see people telling you to use their finger and touch right there, that one specific spot. Everyone is different. Your lymphatic nodes are in a cluster, so you're never going to pinpoint the spot exactly if you just use one finger. So one thing I always say, if you see online and you're just using a finger or two fingers, it's probably someone who hasn't been trained appropriately. It's really, you should use as much of your hand as possible, as much surface area as possible, and just massage the whole area, because your lymph nodes are all spread out through that area.
So less of a like tapping and more of a like rub this area. And it, I think people naturally rub right here when they've got a sore throat, or, you can feel your lymph nodes swollen. I think this is a common knowledge right here. I did not know that you had lymph nodes here. I knew that you had lymph nodes in the armpits just because I've had friends who have, been breast cancer patients and survivors who have dealt with that. And then the groin. That's really interesting. So you can do your own lymphatic drainage, but if we're hearing you properly, you don't need to worry yourself with it every day.
Exactly. It's a tool that if you feel, hey, I'm congested, I'm sick, or you just had a surgery, I again would check with someone who's medically trained, especially after a surgery, just for infection risk, making sure you're not doing anything right or doing anything incorrect, I should say. And then if you have a medical diagnosis, absolutely work with someone.
On your YouTube channel, do you give instruction on some of this?
Yeah, so that was the biggest thing. When I started my channel 5-6 years ago, I created videos for those who have a lymphatic dysfunction. And I got so many questions for people who just wanted to learn more about it because it's something they hear about and should they be doing it. And so there are videos on there that I have shared what the general person can do, absolutely, and then also what someone who has a lymphatic dysfunction like lymphedema can do. And honestly, they're very similar. So most of the routines, anyone could follow them.
Love it. Okay.
You said that like if you feel a cold coming on, like you might rub it. Is there a certain time of day that makes more sense to do it? Beginning of the day, end of the day?
Yeah, that's a really good question. I get that a lot. Is when it comes to the head neck area, if you think about it, you've been laying flat all day. And so yes.
All night, you mean?
All night. Thank you. All night. All night. And so most people wake up a little more puffy in the face, right? That makes sense because you've been laying flat. Fluid and gravity make a difference. So fluid has been more up towards your face and you sit up, it's going to start to drain throughout the day. But if you want to do it in the morning, it can help speed it up and help things drain a little bit quicker in the morning.
But at any time of day too, like
Any
if you're
time
like
of
at
day.
nighttime, you're like, oh, I'm feeling a little
Yeah.
tired, swollen, you're going to have some tea or whatever, you could do some lymphatic
Yeah.
rubbing.
There's not a wrong answer. I just say if someone wants to know the best time of day, morning if you're head and neck, evening if your legs, arms, just because again, gravity has been pooling things. By the end of the day, you're probably more swollen in your feet than you are in your head.
That makes sense. Do all cancers compromise the lymphatic system, and or is there one type that causes lymphedema more than the others?
That's a good question. So really it comes down to you are not at risk for lymphedema unless you have lymph nodes taken out or radiated. So if someone has a cancer and they have no lymph nodes taken out, you're not actually at a risk for lymphedema unless you were again born with something that you didn't know you had. And so it's really when someone has lymph nodes taken. The number one we know is breast cancer. They're usually lymph nodes taken for a biopsy. The more lymph nodes you have taken out, the higher risk you are. But other gynecological cancers, ovarian cancer, they might have groin lymph nodes taken. They might have radiation to that area. So risk of damaging those lymph nodes. But if someone doesn't have a surgery like that, you are not necessarily at a risk.
I mean, this is really interesting. You know what I mean? Like just to be very, I hope you guys are learning along with us where your lymph nodes
Yeah.
are. And there's just been so much. It's just been so, why do you think it's been viral lately?
I don't know. Someone who's lived in this world for over a decade and has had training, over and over for this, I was almost taken back by how much is out there for the wellness side. I think it's great. People know what lymphatic is and what the lymphatic system is, which is great in my world. But I just want people to know that if you don't have a lymphatic dysfunction, you do not need to add something to your list to do each day. I think that's overwhelming. It overwhelms me, and I know how beneficial it can be if someone has an issue. So again, if it serves you, if you're like, oh, this just feels good, I feel better because of it, absolutely, it's great, go ahead. But if you're sitting here like, do I really need to do another thing? No, you don't. You just get moving, stay healthy, exercise, drink water, get some good sleep.
Okay, I love this. Let's just get for one quick question. So back to, you were talking about like your heart is the pump that goes through the veins and the arteries.
Yep.
There is no singular pump for the lymphatic system. So exercise being the best thing you can do.
Yes.
So this kind of goes back to like, all right, get your butt out there and walk every day.
Yeah.
And when you say exercise, it doesn't have to be intense exercise.
No.
It's movement.
It's
right?
movement. Your muscles, when you activate them, they pump and they contract and they relax, and your lymphatics are in there, your vessels are in there, and they contract around them and help push the fluid through. It's as simple as that.
Love it.
We have a breast cancer survivor here. She is 6 years out, so super great. Congratulations. She has kind of a backstory so that you can kind of figure out what she's asking. She had one lymph node removed during surgery and dealt with lymphedema in her arm on the surgical side for about 6 months. It hasn't bothered her since, but is it something that can impact her at any point? Does it go away? Does it not come back? Like, what should she kind of expect? It was only the first 6 months after surgery.
Yeah, it's a good question, and that's something that we treat all the time. So anyone who has lymph nodes taken, technically, the risk is long. However, the greatest risk is the first 1 to 2 years. So when we see someone who is 6 years out, 10 years out, 15, the risk is actually going down because we hadn't seen it yet. That being said, it's just something to be aware of. So if someone has an infection, just from a toenail issue or something random like that, or another medical condition that comes on, those are things that could potentially trigger it in the future. And so all you need to do is just monitor closely, look if your rings don't fit the same, your jewelry fits different, you see size difference, whatever that might be, and then just call either your lymphedema therapist or one locally. And the sooner that we can treat it, the higher the potential that we have to be able to reverse it at that point.
Interesting.
Okay, can you talk about the vibration plates that are super popular right now? Do these work? Thoughts on those, and then we'll ask a couple other follow-up questions.
And I want to just make a point. I was saying to Kelly before we came online, I sold vibration plates on Home Shopping for 5 years. When vibration plates first came out, there were many that were industrial size for gyms. And they were marketed as stand on these things, jiggle yourself and lose weight, which is an absolute no. That's not going to help you lose weight at all. But then it came down to, I was selling a vibration plate that was, a small, maybe the size of a, Bosu ball or something. And you plug it in and it would vibrate. And me personally, when I was selling those on TV, and I still believe this in my heart, they were really good for older people to help with balance and with circulation. Yeah. But my opinion, you don't lose weight. If anyone's trying to market it to you to lose weight or you're going to get stronger because you're standing on it, no. But let's hear your take on it, and let's hear your take on, does it help for lymphedema? That's something I don't know.
Yeah, it's a good question. It's another viral moment for for vibration plates, but I will say there is research to support things like you said. Circulation, it shows that it helps. It does help with blood flow. So there are benefits to it. There is actually help with bone support too. Yes. There are studies being done that say there are benefits to it. So yes, you have the large ones that are in the gyms that people use, and then you have the small ones at home. There are some studies being done right now for those who have lymphedema or lymphatic dysfunction, like a medical diagnosis, and showing that it can help move fluid. We don't have strong studies yet to say this is the best thing, you should be doing this, but there's potential. So again, it comes down to, is it something that you find beneficial for yourself, that you enjoy doing, that fits what you want to do? It absolutely. But again, doesn't need to be for everyone.
It's really interesting. And on that subject, so as an Amazon influencer, Sam and I have been fielding some questions on our social media, like, hey, are you going to, advertise any vibration plate? And have you tried one? And do you know which one's the best? So we were talking about it. And I said, well, maybe, I need to order a couple and see which one works best. Again, I will never tell you can lose weight from a vibration plate. Remember, you guys are way younger than me. Back in the 50s, women used to get on these vibration machines. They didn't exercise. They would just get on vibration machines. Absolutely ridiculous. So, but from the standpoint of circulation, improving balance, potential bone mass support, and lymphatic drainage support, there is some worth. So perhaps that's something, Sam, that we sample out and see in the future. But really interesting, that it could be of some help, but there isn't full support yet.
Right. I think the big thing to know is they're not cheap, so it's not for everyone, and you don't feel like you have to buy one.
Right. Mm-hmm.
But if someone likes it, I have patients who sit at a desk all day and just like the feeling of that they're doing something with the vibration plate underneath them. But there are options. Just if you're doing it for a lymphatic drainage, you have to have one that has a really low setting, and so there are certain ones that do and certain ones that don't.
Okay. Good to know.
So for the woman who's asking, she has an 86-year-old father with lymphedema and wondering if this would be good for him. His mobility is really poor and he doesn't get much movement. So it sounds like that might be something, again, to get him to move a little bit. Again, it might not be for everyone, but.
Right. Something's better than nothing. There are a lot of we call contraindications or precautions. So you want to check with your doctor because there are some medical things that, we can't use vibration plates for. Mm-hmm. One being making sure there's no blood clots or hasn't been recently, things like that. So there's a safety piece to it. But yes, we have people who like to sit in a chair and have their feet up on their vibration plate and get a little bit of activation. Would we ideally like them moving up and walking? Absolutely, but it's not realistic for everyone. So we have to find what works for them.
Right.
Questions about rebounding on like a mini trampoline and benefits. Another thing
one
that has gone viral.
Yeah.
And again, another thing that I sold on home shopping. I've sold it all. But I was a believer and still am a believer in rebounding for the sense of just getting some exercise with lower impact to the joints. Less, pounding on your joints, but you're still bouncing and potentially helping with some bone mass. You will burn more calories on a rebounder than you would on a vibration plate. You do want some instructions so you don't fall. But they can be helpful. It's just not mainstream. We've had some people ask, hey, will you do a rebounder workout on Get Healthy UTV? And it's like, there's just not a big enough audience for us to dedicate a workout to, but never say never. But from the lymphedema or the lymphatic drainage standpoint, how does a rebounder fit in?
Yeah, that's a common one. I do have videos on my channel showing rebounder workouts, and it's just really because it's another way for people to get moving. And people ask me, it's talked about a lot for lymphatic drainage specifically, but again, we have no proof that rebounding is better than walking or vice versa for lymphatics. But some people really enjoy it. So great, you're moving. It is a great exercise. I will say 10 minutes on the rebounder, you will be, huffing and puffing pretty well.
You will be huffing and puffing, yes.
So it's a great workout. It is actually more gentle on the joints, and some people realize if you get the right kind. The springs ones are a little more harsh than the bungee ones are a little more gentle. You can get the handle, and within 10 minutes, you can get a quick, get your muscles pumping, get your calves pumping, get some fluid flowing. Absolutely. But again, don't feel like you need to go spend it if you enjoy something else for exercise.
If you walk outside, walking is going to be your best, right?
Walking's great.
Walking is, but with the rebounder, the ones that I would sell, they always had like a bar, so that people could balance. Because the reality is, you could fall when you're bouncing up and down. So you definitely need to take all precautions. But interesting to know that these are tools that could help. But again, like you said, not for everybody. And do you want to spend the money? If you're already a walker,
right,
you might not need it.
I think that's the biggest thing. I show all of these because I get asked them so much. I have videos on all of them. There are benefits to all of them. But really the big takeaway is find something that works for you. What do you enjoy doing? What gets you moving? What will you do consistently and show up with most days of the week?
Yep. Well, we're back to that word that Sam and I use on the daily, which is consistency. It's not what you do once, it's what you do all the time that will really be health changing.
Right.
That's really it.
Absolutely. We have a member saying she lives in Madison, Wisconsin, and her healthcare providers have never mentioned the lymphatic system to her. Should she get a diagnosis? Is this something that is already checked? They just don't mention it to you. What are your thoughts on that?
Is it someone who has had a cancer treatment or?
No, she just says her healthcare providers have never mentioned the lymphatic system.
Okay.
So is this something that they would touch on if you had a disorder or?
Yeah, it's actually not something that doctors would touch on. And most doctors don't know much about it because they get about an hour of training in medical school. Maybe some get a little bit more. So it's not well known, and it hasn't been. That's really my why of starting my channel was we're in the Twin Cities, and here we have really great health care. And I would treat women after their breast cancer treatment who had lymphedema, and I thought that was a normal thing, but realizing I was very naive and that's not the same care everyone gets. So if someone has had a cancer treatment and has had lymph nodes taken, you should have had a conversation or should have a conversation about what lymphedema is and what your risk is. And so something that you can monitor and we can address sooner than later. So that's a conversation. But if someone doesn't have any medical history of anything like that, there's no need to be concerned. Again, lymphedema, it's very visually obvious. You have a lot of swelling. It's usually on one side of the body, sometimes on both, but it's usually one-sided. And again, it's pretty obvious if someone does have that.
So my doctor's never ever mentioned lymphatic drainage. I just don't think it's anything. Again, I think the internet has made this viral, and everyone's like, oh my God, what's my lymph system? But yes, we all know that lymph nodes swell in your throat when you are sick.
Yeah.
And many of us females, as we've gotten older, know about the lymph nodes in your armpit because of breast cancer. Right. But other than that, like you say, if you're healthy, you don't have to worry about your lymph system. Right. But the best thing we're hearing it from the mouth of the expert is move your body.
Right.
So we have a question about tools like the gua sha, the jade rollers, special body brushes, are those effective, or again, another?
Yeah. It's the
Hot
same.
topic.
It's the same conversation. I have videos on all of these too because some people really enjoy them. Some people love the gua sha or the jade roller because it's cool on their face and it's just nice self-care in the evenings. If you want to do lymphatic drainage with that, absolutely, as long as something's not harming you. So dry brushes is a big one. It's been around for forever, centuries, and it's used as for lymphatic drainage. It's really best for softening the skin, but if you get one that's not great quality, you're really potentially like damaging the skin and causing irritation. So at the end of the day, you don't have to buy anything. Just use your hand. The hand is my favorite tool. You can use your hand to do all lymphatic drainage. But again, if you feel good with the tools, because I have some patients who swear by their tools, as long as they're safe for you, absolutely.
Can you just talk about like the lymphatic brushing for face and body for someone that is interested in it?
Yeah, so the dry brushing is what we use the term, and there are a lot on the market. You do have to be careful because some of the dry brushes are really harsh on the skin. Some are really soft. So again, make sure you're not irritating your skin. We do the exact same routine for someone using their hand and doing lymphatic drainage as you would the dry brush. That's the biggest thing. And the big misconception that you'll see on social media is someone telling you to always brush towards the heart or something like that. You always want to follow what the natural pattern of the lymphatic system is, and that's towards the lymph nodes before it goes back to the heart. So it's just making sure that you're following a correct routine. But again, you don't have to do the brushes. You can use your hand if you're not interested.
I have a question. So if you do decide, hey, I would like to do some lymphatic drainage, I don't know what you'd call it, techniques or protocol, show us what you would do. So let's just say, like, I'm trying to do, like, I have a cold.
Yeah.
Okay, and my lymph nodes are kind of swollen and I'm feeling a little down.
Yeah.
What would I do?
Yeah, so if I sum it up real quickly, I always add breathing. So this might follow with you too, because most, not all of them, but a lot of lymph nodes sit in your abdomen, along with the major vessels that all of the fluid in your body go to before it gets back to the heart. And so deep breathing helps to stimulate those deeper lymphatics that you can't massage. Okay, so we always do a few deep breaths, and then we'll stimulate the lymph nodes, those major areas we talked about, using your whole hand or as much of your hand as possible. And you'll just do 8 to 10 circles, so around the collarbone.
On both sides?
On both sides, and directly on the skin. Ideally, whenever possible, because if you're getting a skin stretch is really what the key is. And they're right on their skin, so you're not pressing hard. This is really light, but you're doing 8 to 10 circles massaging on those areas. Same thing, 8 to 10 circles in both armpits and then both groins. And then if we're talking about the head and neck area, you think about a line that draws right down the middle of the face because your lymphatics is broken up into 2 sides. And then you're moving from the middle of the face outwards towards where those lymph nodes are. And so you're draining or you're just massaging 8 to 10 strokes towards the lymph nodes and all the way, forehead coming all the way down to the side of the face. And then you're draining down the side of the neck to these next lymph nodes.
That is like super interesting, which leads me to ask you, does it help with headaches?
There's some conversation about that. So what we don't know enough of, but we're learning, is there is a correlation with, well, a lot of new things. One being the brain and things like Alzheimer's or neurological conditions. We have what we call the lymphatics, was really only found within the last decade or two, that you have a lymphatic system in your brain, that if that is congested, they see the correlation with things like Alzheimer's and things like that. So we do lymphatic drainage just to help guide everything out. But sorry, what was the question?
The headaches.
The headaches, yes.
Like if I have a
Thank
headache
you.
because I've been getting, I've gotten hormonal headaches, would I do that facial massage? Could that potentially help me?
It actually can. And again, I will do it when I feel sick. Allergy season, cold and flu season, I get a lot of questions. Some people it works amazing for is just doing some of that to relieve some of the sinus pressure. There's a correlation with, again, the brain lymphatics and headaches, that if it's backed up, some people will notice that. So it's a great tool. You don't have to do it every day, but there might be times that it might be beneficial. It also might not help you at all. It could be related to something else, like you're dehydrated.
Right,
but it's something to try.
It takes you a few minutes.
It takes 5 minutes to try. It is not going to do any harm. Again, as long as you have no medical condition like blood clots, it's something you can definitely try.
And definitely, so I like you're saying, like, bring it to the lymph nodes. So if you're going to, smooth out or come from your eyes, like I'll get a headache up here, and push down towards the lymph nodes or out towards these lymph nodes.
Correct. That's the big thing.
Super interesting,
Yeah, for sure. So what about someone with like brain cancer? Like that, I mean, is it technically around like a lymph node, and like would that be helpful or not at all?
Most of the time with brain cancer, they don't have lymph nodes taken. So they're not really
Right.
at a risk for lymphedema. And there's a lot of swelling going on from, especially if they have a radiation or surgery. And so we actually, in the cancer world, we don't do lymphatic drainage unless we're cleared, because there's a lot of treatment and things, there's a lot going on in the body. So we don't do it during treatment unless the doctor's asking us for a variety of reasons. But usually we just wait until someone's treatment's over, and then it's more of a healing tool.
More of a healing tool. Okay. That is interesting to know. I was also thinking that too. I was just curious, do you do it while you're doing chemo?
It's you can if you're cleared. There are times in certain drugs that you don't want to be pushing a lot of things around.
So you have to talk to your doctor.
You have to talk
for
to your
sure.
doctor for
Yes.
sure. During radiation, we don't want it. The skin is really sensitive, so we don't usually do it during, again, unless someone has an issue, the doctor wants us doing it. We don't know enough of there's a lot going on in the body. We don't know enough that we are just being more cautious at that time.
I love hearing the deep breathing. So every workout, what do we start with?
A deep breath.
Deep breaths.
With the squat.
Right, with the squat. Because people, you take 21,000 breaths a day and you don't even think about it.
Yeah.
And deep breathing is one of the best ways to just flood your body with oxygen, which does make you feel good and also calm you down. So all of this health stuff correlates.
Yeah.
But you can see how on the internet, social media in particular, they'll glom onto one wellness concept and they go, everybody needs this. And if you don't do it, oh my gosh, something's going to happen to you. And it creates so much anxiety.
So much anxiety.
Yeah, exactly. I have routines for people who just want to do it, like you said, 5 minutes a day. It's great to do if you feel really good.
If it works
and
for you, but you
works for
don't have to.
You don't have to. If you feel overwhelmed by that, you don't have to.
I do want to mention that we did decide to unlock one of our gold workouts during this Q&A. So we're going to give you the link. You can unlock it. So if you are not a member of Get Healthy GHUTV, or if you are a premium member, not a gold member, this is now open to you. If you're a gold member, you have access. But it's a neck mobility workout. So just talking about our lymph nodes up here, and we're just talking about headaches and different things. It is a really nice routine that many of our members have. It's actually, we recorded it several years ago, and it's just been a popular workout, or maybe I should even say therapy session, more than a workout, that people enjoy. So take advantage of that if you'd like.
Well, something as simple as doing legs up the wall help with lymphatic issues in the lower body. This member has exercised daily for years and is at like a really good weight, but has a lot of swelling in the lower body, especially around her knees.
That's one thing I see online too, is people having their legs up, and gravity can help when it comes to something like lymphedema or like true lymphatic congestion. It's not enough by itself, but at the end of the day, if you're just one who gets a little swelling, it's going to be helpful, absolutely, for just the general person.
If indeed they really do have a problem, they're seeing a lot of swelling in the lower body, what would you suggest next?
Yeah.
Post legs up the wall.
Yeah, if you're doing legs up the wall, if you have lymphedema, you'd have to be there all day for it to do anything for you. So it's really, compression is number one. We add in exercise, lymphatic drainage, again, anything like sleep and nutrition and water intake, things like that. But we want you moving. I would rather have you moving for my patients who have lymphedema. I'd rather have you moving and active and exercising for all of the benefits that come with it versus just having your legs up the wall. But at the end of the day, if you're lounging and want to do that, absolutely.
So could you massage? Would you do the same process where you massage your skin with your whole hand, bringing it up towards the groin?
Yes. So with the legs, you still bring everything towards the groin. If your legs are up, you're just having gravity help you with that process. So absolutely, that works.
So you could add in that whole
Or you can add in, have your legs up and just doing ankle pumps, doing some muscle activation.
Oh, I like
Sliding
that.
heels like that. Yeah, absolutely.
So we have someone with lower leg edema and a history of treated venous varicose veins. How can you tell if the swelling is from like the venous insufficiency, or is it the lymphedema?
It's a really good question. It's not that easy to answer, I will say, unless you have medical testing done. And so if you look at them, if you look at your legs and you notice that the swelling is fairly new, and in the mornings it looks really good actually, and then by the evenings it's worse, that's typically more of a vein issue. Lymphedema tends to be there all the time. yes, it worsens a little, but mornings don't typically look that great. If someone has what we call pitting, so if you squeeze in the skin and it indents and it stays indented when you take your finger away, that tends to be more vein. Lymphedema has more of a tendency to change your skin as well. So it may harden, it may feel thicker. We call it fibrosis if someone's had lymphedema for a while. So that might be something you see. Veins, typically it's both legs. Lymphedema tends to, not always, but tends to be more one-sided. So those are all things that you can look at. Again, the best way to know is a doctor will have you do a vein test. Lymphatic testing is not as common, but they are available in most areas as well, and to see what is truly the reason. But I will say at the end of the day, as a lymphedema therapist, we treat them in a very similar way. So if you work with a therapist, they can help you too.
Who is like the top knowledgeable person to go to with questions when you do have lymphedema? So like medical, non-medical, where do you go first? So you can kind of ask all your questions to them.
To Kelly.
That's right. This is challenging because it depends on where you live. If in your area you have a lymphedema doctor, so it's usually a physical medicine rehab doctor. We have one here in the Twin Cities, maybe 2 or 3 that are, have some knowledge on it, but that's really rare. So I understand that's hard to find a doctor who knows, but they may be out there. Next best thing is a certified lymphedema therapist. And so you want to make sure that they are certified. That is a big thing. They have advanced training, and you can search that online as well. But that would be the next person who has advanced training and knows lymphedema and knows how to treat it as well.
Well, and you are a certified lymphedema therapist, so you are that person. Would they come to your YouTube channel and ask you questions? Would they come to their website? Where's the best place to ask you questions?
That's a good question. I'm not always your best because I don't know your medical history. Okay. I don't know your background, so it's challenging for me to say I can't help you medically online.
Individually, you're giving broad information.
I like to say generally most people, this is how we do lymphatic drainage for, but if you have a medical concern that you have more in-depth questions, you always want to try to find someone local because you deserve the best care too.
You deserve it, yeah.
We have someone with lymphedema in the arms, chin and neck. There are many supplements and creams promising to depuff, like the bat wings, double chins. Are there any that you recommend, or just stay with the manual drainage?
There are none that I recommend. When it comes to the creams, supplements, I know there are some that are out there. There's nothing that I'm aware of that has really good results specifically for lymphatics. So the best thing is compression when possible, lymphatic drainage, exercise. Those 3. Those are the best things.
Speaking our language.
Yeah, exactly.
Speaking our language. And that's why I just said the fountain of youth is not a fountain. It's a dumbbell. I mean, you got to pick it up and do the work. And yes, people take supplements. Supplements don't make you lose weight. The work makes you lose weight. Eating healthy makes you lose weight. Something might be a little helpful or it might curb your appetite, but there is no magic pill or powder.
Right.
Because if there was, it would have already been discovered.
It's true.
But, I hear you loud and clear with the movement thing.
Yeah.
And also, I've learned a lot so far this hour too. And the key is to find that specialist nearby that can really give you what you deserve for help.
Yeah, I think that's the biggest thing. It just make sure they're certified. Some, like massage therapists, might just do the lymphatic drainage piece, but a lymphedema therapist, which could be a massage therapist, but certified lymphedema therapist, they are trained to treat you as a whole with a variety of treatments, not just lymphatic drainage. Because I will be honest, lymphatic drainage is a good tool, but it's actually not the number 1 tool out there. So
for lymphedema.
For lymphedema.
Okay.
And so you just want to make sure that you are getting, again, the best care that you deserve.
So obviously we've talked a lot about like the massage and lymphatic drainage. Are there like exercises other than just moving your body that you recommend, or is it just move your body? Like, are there any certain exercises?
And beyond the rubbing
Yeah.
and the massage.
Yeah, I love this question because it's something I'm passionate about. Is when I was trained, well over a decade ago now, we were taught, not a whole lot, but we knew that doing movements helps with your lymphatics. So we were taught to teach our patients what we call remedial exercises, ankle pumps, heel slides, the basics, which works. But what we're learning and what I'm excited about when it comes to more research and learning more about lymphedema and lymphatics is how strength training can play a role, because over time we've learned that I've seen patients firsthand too who have lost so much muscle strength because they have chronic lymphedema, and we're learning how important strength training is for these individuals as well. So it's not always enough just to do ankle pumps sitting there. Unless that's all you can do, something is always better than nothing. But if we have the ability to do true strength training, get stronger, get your muscles stronger, there's a lot of benefit to that as well.
Do some squats, do some lunges, use the larger muscle groups, get them
Right.
pumping. And muscle is the place where glucose and insulin is regulated. Muscle obviously helps with metabolism and calorie burn. Muscle helps with bone
There's so many
mass.
benefits.
Yeah, there's just so much to it. So super interesting.
Are there any specific dietary guidelines for lymphedema?
This is fairly new as well. We don't have strict guidelines, but we do see that we're leaning towards things like an anti-inflammatory diet may be helpful for someone. Again, eating just healthy choices is what it comes down to. Mm-hmm. So there is one thing that we should know about the general population when it comes to lymphatics. There is a correlation for those who may have had lymph nodes taken for like a cancer treatment. There, you are at a higher risk of developing lymphedema if you are morbidly obese, because we do know that those who are morbidly obese, so again, very high on the BMI scale, if we use BMI as an example, you can cause damage to the lymphatics just because of the excess fatty tissue in those areas. And so we do know there's a risk if someone is there and has lymph nodes taken. So a reason just to stay healthy, make healthy choices, healthy food choices, exercise, but there is some correlation there, so that can play a role as far as just watching your diet just to remain as healthy as possible.
Speaking our language again.
Exactly.
Could doing a lymphatic drainage protocol cause nausea a few hours later?
It can, because really for some people are very in tune with their body and they can feel that lymphatic fluid moving. Mm-hmm. And some people will afterwards feel a little foggy, get a headache, just like some people do when they get massages, just general body massages. Some people get sore. It's just the response to moving all of this fluid, toxins, whatever. So it is possible. We just want to stay hydrated. I would say it doesn't happen very often in my practice, but we're treating them a little bit different than you would if you were getting a standard massage. So absolutely possible. Stay hydrated, but it usually goes away pretty quickly.
Can you talk about the massages? There's your general massage, right? But then there's some that are like they're calling lymphatic massages.
Yes.
Can you talk about those?
Yeah, and I've seen it advertised like, come get a lymphatic massage at some massage therapist. And I mean, I see what you're saying, like right here. And I was telling you, I have a girlfriend who does her lymphatic massage every day, which is great. She's not sick though, so I'm going to remind her, you're not sick. But if she has the time,
if she likes
why not do it?
It feels good for some people.
So when a massage therapist is advertising a lymphatic massage, what do you think?
Yeah. Again, it's an option if it makes you feel good. Like some general massages, they really do a whole lot for your muscles. Some yes, some no. But if it makes you feel really good, it could be beneficial for you, right? So I'm not going to say no to someone.
They're basically doing it for you.
Yeah,
you could do it yourself, but like it is relaxing when someone else is doing it.
Right.
You know, so if you're just laying there and they're, I could see the benefit of that.
Yeah, and if someone has lymphedema, we are actually also not doing just lymphatic drainage massage, but we're also working on fibrotic tissue and tissue changes. So that's a little bit different, but for the general person, please just make sure they have a certification or training, especially if you're doing something like a post-op cosmetic. That is a growing issue right now. People, massage therapists in general are saying we can do lymphatic drainage, but they're not trained.
But if
and
you
that's an
just
issue.
had a surgery, now I don't know, but I don't know if I want anyone massaging. Aren't you like, you have sutures and stuff?
Yeah, that's why someone needs to be trained, which there are people who are trained to move around the incisions. You never let someone try to drain out your incisions, please, ever.
My God.
That is shown online. So just those are things that you want to make sure someone is certified and see what their training is before you do it. But again, if it makes you feel really good, if you feel a lot of benefit to it, and some people who need it on occasion, it can be great.
It's going back to the training.
It comes back to the
Make sure
training.
that you are contacting somebody who you trust and believe, knows what they're doing.
I would say too, with that, if you get confused, anyone can get certified really, but massage therapists, they should have another title with that certification, like lymphatic certification of some sort, because not all massage therapists are trained in lymphatic massage. Not all physical therapists are trained in lymphedema training. So again, just make sure there's another layer of that training.
Do those massages like look very different? Like if you're doing a lymphatic one, I mean, because I've seen like, again, on the internet,
Yeah.
never had one, but like you're laying more on your back. Like is there a huge difference between what those look like?
There are a few different types of lymphatic drainage out there. You'll see the Brazilian one, which tends to be a little bit deeper. It's just how someone is taught in their training. So there's a couple different certifications out there. The biggest thing is going to be looking if you're doing it for a medical reason, that someone has that extra layer. But some people, again, if you're just doing it to feel good, the Brazilian one is just fine. It's just like a feel good, move some fluid kind of massage.
Right.
If you are someone with lymphedema, can you get regular massages and facials, or should you stay away from them?
No, you absolutely can. Again, I would make sure someone knows what they're doing and not trying to move fluid in the wrong direction for you, just so they have an understanding. Usually they'll just avoid the area at times. That's okay too. And you don't want a extremely deep massage that can cause inflammation or bruising or anything like that, because all that's going to do is make the swelling worse.
I'm curious about like something like a Theragun.
Yeah.
You know how when people have like a little Theragun and it's you can put it on different intensities.
That's another hot topic. Yeah.
Okay, so tell us about that. Is that worthy?
So if you're just using it for muscles, great.
Yeah, for muscles, of course, but I mean for lymphatic.
It's not. I would say it's not something I would start with. Again, if you have lymphedema, you got to be a little bit careful because you don't want to add inflammation to the area. What is inflammation? It's swelling. We're not trying to add more swelling to an area. But again, for some people, it just feels good. It gets their muscles, blood flowing.
Great for muscle.
Muscle, great for muscle.
Lymphedema, I don't know if I would. It's pretty intense.
It's not the first thing I would do. That's all I would say. I always hear, like, I have learned over my career, first it was always about, if we don't have research, we can't do that. And I totally understand that not everyone's the same, and we don't have enough research to prove everything. And so for me, it's always, is it safe for someone? Are they going to cause any damage? Are they cause any issues? And if so, okay, how does it make them feel? If they feel overwhelmed by it, we have other things we can do. If they say that I feel a lot of benefit from this, great. As long as it's safe, I think that's great.
Another question that just came through, I just lost it. Here it is. Are you familiar with the tactile flexi touch that massages the lymph nodes? And if so, what do you think about it?
Yeah. So that's one of the pneumatic pumps. That's one of the brands. There's probably like 4 or 5 brands out on the market. It's one of the options. Again, we only use it for people who have lymphedema. It's not necessary to buy if you don't. They're extremely expensive, and you can only get it through insurance if you have a medical diagnosis.
What does it look like?
Like those recovery leg pumps that you've seen, that people wear and they fill up. So this one is specific. Instead of just filling up and staying filled, this one goes through a sequence that it pumps up the leg. So it's supposed to work very similar to how lymphatic drainage works, but it's just a pump style. So it's actually extremely convenient for someone who has lymphedema, who can't reach their legs, or just wants to take it easy on their hands, have arthritis, just want to lounge a little bit more. They can put the pumps on, and it works like their lymphatic drainage for the day.
And these pumps are different than the pumps that athletes are using for recovery?
Yes.
I was
These
just
are
about to
different.
ask that.
You cannot buy these on Amazon.
There you go.
You go through insurance to get them. The doctor will sign an order, and you go through that process.
Okay, because the pumps are the
Normatex.
the
Normatex is what it is.
Normatex are very popular for athletes or people training for endurance races and things like that.
Right.
But totally different tool. Okay.
They look very similar, and I would not, if you have lymphedema, I would not do the recovery ones, because that actually could make it worse too.
Good to know.
Can lymphatic drainage help with weight loss or bloating? Is a question that came through.
And I would add cellulite to that list too, because I get that
Yes.
question a lot.
I'm so glad you just, I was going to bring that up because people are always like, should I be doing these techniques to maybe I have cellulite because my lymph nodes are clogged. I'm like, I don't think so.
This is one area, well, I'll just be honest, I think it's a little bit of a scare tactic. But doing lymphatic drainage, for an hour, 2 hours, for a very short period of time, you can see those visual changes. But you have liters and liters of fluid pumping through you all day long. And so all you're doing is just kind of helping for that brief moment, and then it's going to come right back. So again, it's not going to hurt you to do it, but I would not spend every waking moment thinking about
But you're not
having to add
going
that
to lose
in.
weight because you did
Losing
lymphatic
weight,
drainage.
same thing. No, that's not going to make much of a difference at all. Again, the only time I would say it's going to make you lose weight is if you have lymphedema. We get rid of the fluid. I've had people lose, up to 80, 100 pounds of fluid, but again, for a medical reason.
For a medical reason.
And that's the only thing that you may hear that actually I have seen to be very true.
But if you're trying to drop 5 pounds, lymphatic drainage is not going to be going back to that's not how you're going to lose weight.
It's not a long-term fix.
No.
And the whole cellulite thing too, like you hear the dry brushing and there was some woman who invented a machine. I can't remember what it is. People ask me about it all the time. And it looks like it has just little
Yeah. I know which one you're talking
not
about.
rubber, but what do you say? Plastic spikes on it. And you go like this and rake your leg pretty much. And for a split second after you rake your leg, you can't really see the cellulite, but it's not removing cellulite. But they claim it's creating circulation, which it could be.
It could be, and that's what you see the difference of is because now there's a little bit more blood flow there, so you don't see that same surface.
Right.
So that's why it's a temporary thing, again, for a couple hours versus not a long-term thing.
Well, and one thing about it is cellulite is just body fat pillowing through muscle fibers. So even thin people have cellulite because as you get older, those muscle fibers loosen up and any body fat that you have, whether you have a little or a lot, can pillow through. So your best defense against cellulite is to tighten those muscle fibers so that the cellulite can't pillow through, if you will. But as you do get older, like I'm turning 60 in a couple of months, I have a little cellulite, like it happens on the back of your legs, and I don't care because I know that my legs are strong. You know what I mean?
Right.
Yeah.
We had a question come through about the pumps again. Are the pumps beneficial for internal swelling, thinking like head and neck cancers?
There is a pump out on the market that is for head and neck cancer. So again, medically, there are options out there. It's okay for some people, it's not for everyone. So it's, again, work with a lymphedema therapist who can trial things with you, find what works for you. But there are options, absolutely.
Are there any recommendations like before or after a lymphatic drainage? Drink water, like avoid, alcohol, exercise. What are some of your tools before or after doing something like this?
Yeah, I think the biggest thing is stay hydrated, drink water. Another thing is when you are dehydrated, your lymph nodes will swell too. So staying hydrated is also helpful for your lymphatics, just really basic things. And that's really it. Get moving. Get going
moving.
And get going on the day.
You and I were talking about element.
Yeah.
So electrolytes are also helpful.
Right. It's just going back to your basics for your lymphatics. It's the exercise. It's trying to pick up healthy eating options, staying hydrated, getting good sleep. That's what it comes down to for the general population.
It's the boring stuff that you already know
There's
that
no
help
secret
you.
sauce.
Well, this has been super interesting about lymphatic drainage. It has just been so viral on the internet. We get questions. I think people are confused. Should I? Shouldn't I? Am I worried about it? Am I supposed to have anxiety? You've made it really easy to understand.
Good.
So we find you on YouTube. You have a lot of just basic videos that can, again, go through some of this education.
Yeah, so my handle is Cancer Rehab PT, and yes, it starts with cancer, but a lot of my content, especially on YouTube, is really for lymphatics and general lymphedema because of all the questions I get. So you can probably find one of those questions, or every single one of those questions I probably answer in a YouTube video, but happy to answer any others again. But if you have a medical question for your personal, I would highly recommend finding a specialist near you because, again, I'll say it again, you deserve really better care than that.
Yeah, that is awesome. Wow, this has been interesting.
It goes by quick.
How did an hour go by? I mean, that's really crazy. Thank you for coming in.
Thanks for having me. That was great.
So appreciated. I'm sure that our community really appreciates it too. Thank you guys for working so hard and taking care of yourself and spending the time to listen to things that are important. I think it rang loud and clear. Deal with a specialist.
Yeah.
Deal with a specialist.
Don't just deal with an influencer online who just picked up something and said, hey, you need lymphatic drainage. I mean, you need to know more about it. So super fun. Thank you so much for joining us. If you can always rewatch this. It's going to live on our website.
YouTube, Facebook, and Instagram.
Okay, and on GetHealthyUTV.com, you can watch all past Q&As too.
Yes.
So we've had some interesting guests and interesting subjects. So thank you, Kelly.
Yeah, thanks for having me. It's fun being here.
All right. Thanks, everybody. Have a great day.